Ozempic or semaglutide was originally designed to treat type 2 diabetes. Today, however, the drug is used off-label for weight control and has a sister drug, Wegovy, which is indicated for this purpose. Today, there seems to be a new indication on the horizon. Stick around to learn more. GLP-1, or glucagon-like protein 1, is a hormone that is produced in the bowel in response to the intake of food. It stimulates the secretion of insulin, decreases the rate of emptying of the stomach, and suppresses the appetite. These features made GLP-1 an attractive drug for the treatment of diabetes. But there was one problem. GLP-1 is rapidly inactivated by an enzyme known as DPP-4 or Dipeptidyl Peptidase 4, giving it a half-life of just 1 to 2 minutes. Scientists solved this problem by developing a similar drug that bound to the same receptor but which did not undergo rapid inactivation by DPP-4. Ozempic or semaglutide is a member of this class of drugs known as GLP-1 agonists. Patients who used Ozempic or semaglutide for their diabetes reported weight loss, prompting the off-label use of this drug as well as the development of a similar product, Wegovy, for weight control. Other patients reported other side effects, such as loss of interest in drinking alcohol and a reduction in the number of cigarettes smoked, as well as improvement in addictive behaviors such as compulsive shopping or nail biting. After these reports, scientists ran experiments on laboratory animals that were addicted to alcohol or nicotine. Lo and behold, this class of drugs caused an improvement, a decrease in the addictive behavior in laboratory animals. They then conducted similar experiments with GLP-1 agonists in humans, in people addicted to alcohol and to nicotine. As small as these studies were, they met with some measures of success. People who were addicted to nicotine reported improved abstinence as well as a decrease in cravings and withdrawal symptoms and a reduction in weight gain in quitters. A pilot study in type 2 diabetic patients who drank alcohol and who were given liraglutide, one of the drugs in this class, reported a decrease in alcohol intake. Another study done in patients with cocaine use disorder who were given a GLP-1 agonist did not report any change in their behavior. However, this study involved a single dose of GLP-1 agonist, which was hardly enough to bring about the necessary changes in the brain to see an effect. There are many theories of addiction, and one of the most dominant is the incentive sensitization theory. According to this theory, people become addicted when they become sensitized to certain triggers or cues in a process known as incentive salience. These people hyperreact to places, people, things, or states of mind that are linked to their addictive behavior. They react to these triggers or cues by flooding the reward centers of the brain, known as the mesolimbic area, with dopamine. Drugs like Ozempic or semaglutide and other GLP-1 agonists suppress the release of dopamine in the reward centers of the brain, decreasing the addictive behavior. This may explain why some patients on Ozempic for their diabetes experience improvement in their addictive behaviors, such as alcohol drinking, cigarette smoking, nail biting, and compulsive shopping. And at the same time, it creates hope, new hope for patients with addictive disorders. Thank you for watching. Like the video, leave your comments in the box below, share the video with your friends and family, and support the channel by subscribing. Until the next video, stay healthy and stay safe.